We're speaking this morning to Dr. C.D Siby. He is an Ayurveda practitioner. Good morning, Siby. Thank you so much for speaking to us on the LITE Breakfast.
Thank you so much for inviting me. Good morning to all of you. It's a great morning.
Now, first of all, Siby, what got you interested in becoming an Ayurveda practitioner? Was there a particular incident or event that sort of led you to this path?
Oh, that's a long story. Do we have the time?
Yes, we do. Go ahead. Yeah, no problem.
Maybe you can summarize it for us.
Yeah. There was this period, my father had a skin issue, which was actually an after effect of a cat's bite. A cat bite him.
A cat bit him. Okay,
right.
Because it was a trap put for a rat, but the cat got trapped into it, and my father's feet also accidentally went inside, and the cat bit him.
Okay.
This happened when he was 18 or 19 years old. Then when he became 40 or maybe 42 or 44, that time, that bite or that skin condition, which was treated well, started getting some infection. Then infection becomes so serious that the doctor said, the infection has already gone to the knee, you may have to amputate the leg.
Oh, wow. Okay.
Then somebody advised him, well, there is this traditional physician in the village. Maybe you should visit him, just have a second opinion. He went there. And then he treated him and saved his feet. That means you don't need to amputate it. So he got some interest in it. He started collecting a lot of paper cuttings and magazines. Any information connected to Ayurveda, he started collecting it. Then he had some kind of thing. So during that time, I was the person who was helping him to make the decoction. In village, you have to go and pluck the plants and bring it and cut it and boil it. So I think I was 12 or 11 years old at that time. So he asked me when I completed my SPM that time. So he said, you should think about this, studying this Ayurveda. I find it very amazing. And there is this college which is actually calling for interview. By that time, I was already got an admission into another college nearby in my village. Then he said, you must try this. So I said, okay. I went there. They had more than 1,000 students, and they have selected only 20 students out of that applying for it. And that is how I got interested into it. So it was my father who had a good experience, and he asked me to study. That's how I was inside.
But you said earlier that you were already in another college at that time before you joined this Ayurvedic college.
Week. Yeah, just 1 week.
Oh, just 1 week. What were you in the college for? What did you want to become, actually?
Actually, I was studying I had some good marks in mathematics, so I took the first group, where I could study and become an engineer.
Oh, you wanted to become an engineer. Okay. Now you're the engineer of the body. But like you said, do you have to go to school to practice Ayurveda, or can you learn it from a mentor? What are some of the qualifications needed to become an Ayurvedic practitioner?
If you look at traditionally, it was like you have to go and learn under somebody for 7 years or 12 years, something like that. But at that point of time, when I finished that point of time, there was already professional colleges where you need to study, find a proper degree, which is called Bachelor in Ayurvedic Medicine and Surgery. And when I joined this particular
Bachelor,
college,
sorry, we couldn't really hear that.
Bachelor in Ayurvedic Medicine and Surgery, which is BAMS.
Okay.
So it's equivalent like any conventional system, like MBBS, BAMS. But when I joined this college was actually teaching us something like an integrative college. But so the period was 7.5 years to get the degree.
7 years.
7.5 years.
7.5 years. Wow.
To get this BAMS degree, then only you can actually start practicing professionally. I studied in this Madras University in a city called Coimbatore. That's why I completed it.
Okay. But do you have to have some sort of an inborn talent or a gift as well to become an Ayurvedic practitioner?
A healer.
Yeah.
I'm not sure. Anyway, I believe that healing is not done by us. It's done by the patient and the God.
Mm.
We are just somebody who is directing the patient. Okay, you do this, you do this, you do this, it will help you. The healing is not done by us. That's what I feel. So what we are doing is, see, Ayurveda is a system which is more than 5,000 years old with the present documentation available. So naturally, this is not a progressive like science like conventional system where every day they are finding something new. But Ayurveda is something which is already found, and we don't need to do anything new there. Whatever is written in those documents, we have to just practice it without any adulteration. Just do it authentically. That's our responsibility. And if you could do that without any compromise, if we could just do justice to the system, it will work.
Okay. Tell us about Ayurveda. How does it work?
See,
Is it
Ayurveda
all, or is it because in my opinion, it's mostly herbs. You just take herbs and then the herbs will heal your body or of any of ailments and things like that.
Yeah,
So
but
how
then-
does Ayurveda work?
Yeah, because you mentioned surgery. I didn't know Ayurveda had surgery as well.
Yeah. See, the basic theory Ayurveda believes that we are made up of 5 elements: air, space, water, earth, and fire element. And these 5 elements are there in everything we see. Even in this computer, it is there. Even in the paper, it's there. In the wood, it's there. In animal, in human being, these 5 elements are there. There is no 6th element. So far, nobody told us about the 6th element yet. This means at that time itself, they said there's only 5 elements. But if you are intelligent enough, find the 6th element. That's how they stop it. But we can talk about 5 elements because these 5 elements we could identify. And these 5 elements actually, along with life force, we have a life. So that life force is the additional thing into our system. As a human being, we have these 3 basic humors in the body, which controls our complete system. And these 3 humors represent the 5 elements, like air and space element constitute Vata. We call it Vata element. And fire and water element constitute Pitta.
Pitta.
And fire,
Vada, Pitta. Okay.
and then the third one is called Kapha, which is water and earth element. So fire, just take this Vata, Pitta, Kapha. These are the 3 internal humors or 3 internal constitution, which takes care of the complete functions of the body from the day we are born until we die. So just take the air and space element. If you look at it, the qualities, it moves, it carries the things, it takes care of everything which moves. So in the body, which is almost similar to the central nervous system and thought process, everything. And water and earth element, just like a petrol, there is water and earth, it's fire and water element, like petrol. That is the one which transforms, which cooks, which actually grow you from that. And kapha is the one which gives you the shape. Like for a chicken, if it has a shape, or a human being which has a shape, it's because of kapha, like water and earth, which give the shape for the system. So these are the 3 which basically which is interrelated with 5 elements. And imagine, suppose you are all the 3 are there in our bodies. In some people, the fire and water element can be higher. In some people, water and earth element can be higher. In some people, air and space element can be higher. Depends upon that, our characteristics, our shape, our thought process, the diseases which affects you, everything can be determined by understanding these 3 humors. So for an example, suppose you are having a Vata Pitta constitution where Kapha is a little lesser. So Vata Pitta constitution means Vata element, which is air and space element, is high in you. So naturally that air and space element, air space, which dries. So those people will be lean, will be short, they will be very fast in talking. They are very, they have a lot of skills with them. They can do too many things at a time. At the same time, they will have this overdoing things, like, when they like something, they overdo it and they exhaust themselves. And those people like sometimes cold, sometimes warm, too hot or hot also not like, too cold also cannot tolerate it. Their digestion will be erratic, sometimes good, sometimes bad. If they eat too much, it can affect them. And they tend to get joint pains because bones contain pores, which contain more air element. And when so those kind of illnesses which affects them will be almost similar to that. So for them, air and space element is high. So to subside it, suppose they get a joint pain, we understand air and space element is higher than water and fire element. So we introduce herb, which can bring down the air and space element. So to create an equilibrium. And that is the principle of Ayurvedic treatment. Whatever is higher, you introduce. So there may be some plants which contain more water and fire element. We introduce that into the system to treat it.
Well, it sounds very similar to the Chinese medicine yin and yang to find that balance.
It's the same, actually. The only difference is they have this wood element, which we don't have. They say space element. You can't see the space element. Why do you want us to talk about it? So we have space element. Space means I am sitting in a space. So myself and you, in between us, there is a space element. So this space element also, they give so much importance in Ayurveda. But Chinese system says there is a wood element, which is a little different there. Otherwise, theories, practicals, approach, everything is the same in most of the traditional systems.
Yeah, because they are both ancient healing methods, like from thousands and thousands of years ago.
Correct.
Yeah.
A lot of similarities are there between all these traditional systems.
What kind of ailments or illnesses can Ayurveda help treat? What kind of healing would best benefit from Ayurveda, I guess?
Actually, if you look at it, Ayurveda has divided into 8 branches, which is, we call it Kaya, which is general medicine, which treats the complete systemic systems of the body, like fever and, arthritis conditions. And they also Bala, which is pediatrics, conditions connected to children, and also, which also comes with gynecological condition. Griha, which is connected to psychiatric conditions, is connected to schizophrenia, bipolar, depression, anxiety, and Griha Urdhvanga, ENT, which is connected to ear, nose, and throat. Shalya, which is a surgical part, which actually wherever there is a surgery needed, surgery is introduced. Griha Urdhvanga, Shalya, Damsha, which is toxicology, study of poison, poisonous bites, and how to be treated. And Vrudha, Shalya, Damsha, Jara, and which is aphrodisiac, which is introduced for the people to have a healthy body and healthy. This is for youngsters to improve the virility. And also they have rejuvenation, which is called for old people who wanted to maintain their physical fitness without having any sickness. So they have this rejuvenation. So it is actually, when it comes to Kaya, which is general medicine, it treats, they talk about all kinds of illnesses which can affect from the head to the tip of the toe. So it has a very comprehensive, wide range of approach. So if a child come with a cold at 1 day old until 100 years of person who comes with any sickness, Ayurveda has its answer. Something can be done through Ayurvedic treatment program. But unfortunately, I would say, there was this period from 1827 to 1927 when a lot of invaders came into India. And they have taken a lot of documentation, and they actually forcefully stopped practicing Ayurveda and traditional medicine, closed all the universities which was there. So more conventional system came into the picture, and that period of time, I would say maybe the dark ages of Ayurveda. So a lot of documents has been stolen or maybe not missing. So the surgical part was at present not so well developed. But if you look at the first surgeon, even at present also, the first surgeon which is mentioned in modern textbook also is a person called Shushruta, who is the first surgeon, who is an Ayurvedic physician. So he has explained a lot of instruments and how it should be, what are the names of it, how to be used, and all those explanations are there. But unfortunately, those documents are not there. At the same time, after the Second World War, the modern system has come up in its surgical procedures. So our great strength is we have answers for all chronic metabolic diseases, almost all chronic diseases. But if
even cancers.
Yes, but even cancer, certain stages we can definitely help. But at the same time, when there's an emergency, an accident, or a surgical condition, or maybe an infectious disease, we are not so good at it. That one, I would say, they are the best conventional system. So, but otherwise, if you come a non-communicable disease or a metabolic disorder like blood pressure, hypertension, diabetes, cholesterol, there are a lot of diseases which Ayurveda can do a lot better than any other system.
But what does for you, an Ayurvedic practitioner, a doctor, when you see how they're dealing with COVID right now, they say, "Oh, you can't fix COVID. The vaccine, this vaccine, that." How does Ayurveda fit into trying to fix COVID?
See, pandemic or epidemic was already mentioned in Ayurvedic text, which is called Janabadodvamsa, even that time. So they are explaining the same thing, the SOPs which we follow. And they don't talk about the sanitizer, of course, but they talk about a lot of herbal combination. And they say if you're going out, make sure when you come back, wash your hands, wash your feet, change your dress. Don't share the food at that point of time. Don't share the clothes. So they use a lot of SOPs for us to follow. Also, there are a lot of herbal combination which is given, which is prescribed, like home remedies. At the same, a lot of herbal combinations are given, like for example, COVID-19 is affecting us in the respiratory tract and the immune system. So the herbal combination which they explain is something to protect the lungs as well as for the immune system. And there are in India, Ayush, which is the Ministry of Ayush, which they are talking about Ayurveda, Yoga, Unani, homeopathy, as well as naturopathy. They have formed a ministry in India, and they have sent a lot of circulations and circulatives how to prevent through Ayurveda, and if you have, how to treat it, and also how to maintain your immune system. They're explaining a lot of techniques about it. And then at the same time, because of this, anything which we introduce into the public, there are a lot of protocols we have to follow. And it is too close for any ministry to take a decision and say, okay, you do this, but in the mainstream, you need evidence. Without evidence, they won't accept just because you say something. Otherwise, Ayurveda does have a lot of helping tools and materials and advices on diet and regimen and food and how to prevent and how to protect and how to treat. All these explanations are still there. Yeah. And I understand in India, there are 2 colleges, 2 hospitals, the big hospital, they are treating by using only Ayurvedic medicines.
Oh.
Yeah, I understand in China as well. They have Chinese medicine hospitals to treat COVID-19 patients. Oh. Now, doctor, how much of what you're practicing, right? It's a cultural or spiritual belief. Like, can the effectiveness of Ayurveda be proven by science?
Of course. You see, all this science, if you look at the theory, you should see it, you should try it, you should make it happen. And then you trial and error comes, you again do it and again record it. It's all these components which you see are completely scientifically proven thing. But the parameters which is used in traditional medicine and the parameters which is used in the conventional system, it's totally different. For an example, suppose I say hibiscus plant is good for hair growth, is good for improving the luster of the hair. They will ask us what ingredient of the hibiscus work there. But we don't believe in it. We say, no, it is a synergetic action of hibiscus along with cow's milk and the coconut oil. You boil together, you get the milk oil out of it. When you apply that, the hair grows. It's a totally different theory.
Yeah.
So that is this theoretical difference is the major gap between the conventional and this one. So that is one part. Second, culture or religion, all those things has nothing to do with this, because Ayurveda says that even these systems of the medicine were there even before religion came into the picture. So it is just something came only recently. Maybe you can talk about maybe a few thousand years, but this is something which is before that. And in Ayurveda, they mention about yoga. That means yoga was even before Ayurveda. It was already there. Otherwise, Ayurveda did not mention about yoga. So nothing to do with any culture, nothing to do with, they just look at it. If you are made up with 5 elements and if you have a life force and if you're alive, it can be treated. It can be addressed. So it's very simple. There's nothing to do with anything.
Is it only treating with herbs though, doctor? Like, because I read there's some like energy healing as well in Ayurveda. Like, is it only with herbs, knowing what you're lacking in your body and then treating it with herbs? Is that what you practice?
There are 2 theories there. One is Ayurveda says Jagat Teva Manoshada, means everything which is available in this earth, or in this world can be used as a medicine. Only you should know how much to use. For an example, when you create a vaccine, you're taking a poison, but which is actually created in a different way and injecting back to heal you. So you know how to use that poison to treat you. So if you know how to use the poison, it can become a medicine. At the same time, if you have the nectar and if you don't know how to use it, that can become a poison also. So that depends upon who has the knowledge, a qualified physician, and he should be having the experience in theoretical and practical knowledge. Then he will be able to use anything under the sky. So herbs are used, animal products are used, metals and minerals are used. Anything is used to treat it. But because now there are a lot of reservation are there on animal products and metals, minerals. So now it's almost 99% is herbal only used. But like for an example, take a cancer condition where cancer is a condition where you may have to use a very strong medicine, which you may not be able to use only with the usage of herbs. You may have to use, like there is a product called a medicine called Resa Sindhuram. Resa is basically a Sanskrit term which is used for mercury. And this mercury,
Okay.
which is actually purified using 18 steps, a very stringent procedures. And this mercury becomes completely edible. You won't find any traces of mercury in that. And it is very strong medicine to treat a cancer condition, which is equal to like a chemo only. And so there are powerful medicines, but nowadays those powerful medicines, you can't bring it into Malaysia because of the stringent regulations. You can only bring everything. But in India, there are physicians who is using it safely without having any side effects. If you know how to prepare it without having any complications, and the permitted amount of chemicals goes into the body, so it is going to be absolutely fine. See, we also have this. We have to understand one thing, that at present, we are not living in an environment where the water is safe, earth is safe, air is safe, and even anything we take it from the soil is contaminated because so much of chemicals are there.
Or it's GMO'd.
Yeah.
All these things are actually affecting us also. So even if you're taking a herb, even if you're taking a vegetable, we are still just because of the presence of the chemicals in that. So hopefully we will have to do something seriously. Otherwise, we are moving into a place where even a lady's finger you have to think twice before cooking it, whether it is safe or not. So at least considering this amount of toxins, we will have to change. So hopefully people will understand and reduce all these chemical things which is emerging into the sea and the water. And the other part of it, which I want to tell you, is that when you talk about healing, in healing, the best healing is, when you go to somebody, like you may have seen in pictures or maybe in movies, somebody goes to a teacher or maybe a guru or maybe a saint, and he just touch your head and say, don't worry, you will be fine.
Yeah.
Right? And there, he's not using any plants, he's not using any animal products, he's not giving any medicine, he's not giving any tablet, he just touched, which is called spiritual healing. He's using an energy, because this person who's they have full faith and belief, and the other person also is using an energy through a spiritual energy which he has it. That is the best healing. There's no doubt about it, because he's not taking anything from the nature. But the second is the using of the herbs. Herbs means, remember, we still have to answer to the nature, because we are taking a plant from the Mother Earth. And when you're actually treating, you are using so many plants cut together. You're killing those plants also, just because you fell sick and you are not taking care of it.
Right.
We are still answerable to the nature. That is considered second. In third, you use animal products. In fourth, you use, some people use bad spirits and all those things into treating. All those things are considered the lowest way of healing people. But all these things are healing. When people are desperate, they will use anything because they want life back. So what I'm trying to say, all are there. It's on the roll, but we know how to use it. But in Ayurveda, primarily it's herbs.
Is it an Ayurvedic lifestyle as well that you have to adopt if you want to adopt this form of healing?
Yeah, see, Ayurveda have three, or you can say two aims in life. One is called preventive measures. And Ayurveda gives so much of importance in preventing diseases from developing. And second part is treatment of diseases, where they talk about all kinds of diseases, how it develops, and what is the pathogenesis, how the treatment should be done, and how to be treated. But the first part is always given so much importance in preventing from disease from developing. For an example, suppose you have a COVID-19, or suppose there is a pandemic which is going around our side. What are the preventive measures we should do to? So we have two challenges. One is make sure our lung functions are strong. Second, make sure our immune system is strong. So to prevent or protect the lung system, what we should say, don't take foods. It can sensitive your throat. Don't take salad, which is uncooked vegetable. We don't know what kind of chemical they use. Just make sure the lungs don't get into a cold. Make sure you avoid milk products and cold stuffs. Make sure that you exercise regularly. Make sure that you wake up early, go to sleep early. Make sure that you try and eat light food to make sure your digestive system is. So these are the preventive measures, or this is used in every condition, not because Ayurvedic medicine is introduced. Like for an example, if you have a cough, don't take cold stuff. It's a simple common sense. If you take cold stuff, you'll get more cough. So those kinds of regimen is introduced only to support the healing. If you know a correct food, that is half the medicine.
Yeah.
So is there like, it's a horrible term to use, is there Ayurveda vitamins like to help prevent
supplements?
Supplements.
Yeah, sure.
There are. Okay.
There are a lot of supplements, a lot of rejuvenating tonics are there. That's why I said there is a seventh branches for young people to have their strength. And the eighth one is the old people who say, I'm 70 years, but I just want to maintain my fitness. What can I do? So there are procedures, there are oil treatment, there are rejuvenation program, there is detoxification program, and also there are some supplements which is given to maintain the fitness.
So you would recommend someone with no major health issues to go for Ayurvedic healing?
Sure. There's no doubt. We have a hospital in India which is called Ayurveda Pharmacy Limited, where it's a 120-bed hospital where you won't believe 40% of the patient every year are coming from the European countries only to prevent from disease from developing, only to rejuvenate, only to maintain their fitness. So there's a lot of procedures and support and advices can be given through Ayurvedic treatment.
Is Ayurveda now, these days, more accepted globally, especially in the Western cultures?
Yeah, sure. Now in India, there are 400 colleges are there teaching Ayurveda in Hong Kong, in Holland, in every part of the world you check, there are traditional Ayurvedic practice. If I'm not mistaken, about 6 years back, I went to Melbourne to give a presentation. There were 200 Ayurvedic practitioners attended that conference.
Wow.
Who is practicing in Australia. So global awareness, informations are everywhere there. So it is getting into that stage where people understand this is a system which has some role to play to protect the health, to treat some conditions. It has its own benefits on it.
Yeah. Tell us about some of your most memorable success stories of patients that you have helped in your practice, doctor.
There are so many. I had this recently. There was this patient who came to me who is having a backache, and she was actually having this backache for the past 3 years, and she was advised to go for a surgery because it was diagnosed that there was a disc which is coming out and pinching the nerve.
Okay.
And then the pain was radiating from the lower back into that, and she was finding it difficult to sit and work for more than half an hour.
Oops. Is that me? You were saying that she couldn't sit. Yeah.
And then so she came and she was advised to do a surgery, but she said, if I'm going to have a surgery, then I have to spend some time, some money, and my medical card already exhausted with so many medicines. And so I said, okay, you can try this medications, and you can try this oil treatment program, and you can try this exercises and breathing techniques and everything. So I advised her, you may have to stay in the center for 3 weeks. And she said, oh, doc, that's going to be a little difficult. I can't take that many leaves. You just tell me what can I do at home, and can I carry the medicines, and can I apply the oil at home? I said, yes, you can do, but you have to make sure you spend application of this medicated oil on your from the hip down to the tip of the toe. You need to lie down for an hour every day. And then you have to follow this diet strictly, and you have to do this exercise every day. You need to take these herbal combinations. Then she asked me a question is, if I do that, doc, can you guarantee me that in 3 months period of time that my slip disc will be back to normal? I said, yes, but if you follow everything strictly, but normally I'm not somebody who can guarantee anything because, we are human beings, how to guarantee something.
Yeah.
And if you guarantee me that you will follow me strictly, I will guarantee you that you will be healed. She said, yes, I will follow everything. No problem about it. I can actually do that. And then she started the medicines. 1 month over, she came and told me, doc, my pain is more severe than what you said. I have already spent more than 400 ringgits, and including the oils, it's going to be a little difficult for me to do it. So what shall I do? I said, no, it's okay. You continue. 72 days over, she came and told me the same thing. My pain is still the same, doctor, and I think I'm wasting my time. I think it's okay, doc. I said, no, can you just continue for another 2 weeks and see? When she completed 90 days, then she said, I don't know, the pain is not there in my back. And I don't know, is it true? So can I take an MRI and check whether my slip disc is back to the normal? Yes, you can take an MRI and check, your slip disc will be back. And she said, oh, are you sure, doctor? Maybe I should continue the medicine for another 2-3 months. I said, no, you check the MRI. The disc will be back to space, otherwise the pain won't go. And she took an MRI and the disc was back in space. So this is a very simple case which happened recently, but I want to share one. Do we have time?
Yeah.
I want to share one more chronic case, which actually is, there was this patient, she was diagnosed with cancer, and her name was Anne. And she came to me and said, doc, I have this cancer of my breast and it's 4th stage, and my doctors told me that I'm not going to be able to survive if I don't do chemotherapy, surgery, and radiation. And so do you have anything to tell? I said, this is about 10 or 12 years. So I said, and I don't think I can do much. I would suggest that you better go to the hospital and do the chemotherapy and surgery and come back to me. That would be better. She said, okay, no problem, I'm fine. Then she left me. After an year, she came to me. And when she came back to me, her, just imagine the breast is like a cauliflower, which is red in color, and there is pus discharge, there is blood discharge, and it's completely wet. And she puts a lot of cotton and bandages on the chest and cover it with her long dress. And then, so I said, and what you did? Oh, I tried a lot of coffee enema, a lot of fruit juices, a lot of juicing, and a lot of enemas, a lot of herbal things, and a lot of that and this. 1 year over, and she lost almost another 6 or 8 kilos. I said, why you didn't go to the doctor and do the treatment program? No, I thought I don't want to try because even nobody's giving me a guarantee. I said, and nobody can give a guarantee on cancer management on 4th stage. At least you should try and do the best which is available.
Also, she didn't go for chemo.
Yeah, she didn't go for it. But she went, because I did not take up the case, she went to another
Right.
alternative and tried whatever is possible. But when she came to me, already the cancer has already spread into the lungs. It has already gone into the bones. It has already gone into the, not abdomen, but some areas of the lungs was, affected. And she was not able to even breathe properly. She was not able to even sit for a long. She was taking pen. Then I was surprised at how she survived it, this 1 year with all these things. So I said, and 1 year back, I told you I won't be able to take it. Now you have become more severe than this. Why can't you just take a decision? No, doc. I went to my doctor, just my physician again, and he scolded me for whatever I have done. He said, even if I do anything, my survival is only for 3 months.
Okay.
So I said, okay. And so why should I do anything? And can you just do something? I said, but it's very difficult, very challenging, and it's not in a position to tell you anything. doctor, you are not the healer. He heals, right? Can you just treat me whatever the way you can? So that was like a knock in my head telling me that I don't heal, he heals. So what are you talking too much about it? Just treat me.
Mm.
I said, okay, then you get admitted. I'm fine with it. So I tried to get her contacts. I said, can you give me any contact number? Oh, I don't have anybody. I said, your family members? Oh, and nobody keep in touch with me. Your friends? Oh, I don't have it.
Oh my God. Huh.
I said, then if anything happens to you, what I'll do? Or you just do whatever you can. And one more thing, I don't have any money. I
Oh
said,
God.
if you're going to get admitted, then who is going to? I will pay you. When you improve me, I will work for you later, and then I will pay you later. I said, oh, that's very good. And I said, okay, she got admitted. So only thing I do is give her some porridge. Every day, morning and evening, we just dress the wound. We give her a bed. She stayed there every day, but she can't even eat. So we have to literally feed her. We have to give her the shower, dress the wound in such a way that, she don't see when you get a cancer wound, you don't have pain unless when you move, because there's no sensory nerves into that region. But
Yeah.
it looks very bad, like wound. Month over, 2 months over, 3 months over, the wound started getting into smaller and smaller and smaller. And she said, why are you giving me this rice porridge all the time? There's no salt, there's no veggie, there is nothing. Can you give me an idli or those? Everybody's eating those kind of things. Why are you feeding me like this? Is it because I'm not paying you? I said, no, the digestion is poor. That is why if you feel hungry, well, so slowly she started eating idli. She started eating rice. She started eating chapati. Slowly, she started sitting herself, started going to the shower slowly. She started coming to the kitchen and help the chef. Hey, I will cut some vegetable for you like that. So she started moving around into every room and asked the patient, what happened to you? Why are you here? She became like a part of our IU center.
Mm-mm.
In 6 months, 9 months, the wound all 80% healed. She could breathe better, she could move around, she could actually talk, and she started helping in certain things in the kitchen, in the bedroom, and all for the patient. She carries some. She has become a part of our place.
Yeah.
No, 9 months over, suddenly one friend suddenly came from somewhere and said, "I am Anne's friend. Can I meet Anne?" Oh, Anne said she don't have
She
anybody.
have friends, yeah.
So one friend suddenly came and said, I want to meet Anne and she's my friend. She said, there's no friend. No, no, no. She basically, I came to know through another person that, no, actually she's my friend. So she came and met, and 2, 3 visits happened. So I said, Anne, you have friends? Yeah, yeah, all these people were not actually looking after me. Now they are all coming. So I said, okay, good. It's good that you have somebody. 3 months over, she started looking fresh, healthy, and but we know cancer is there. It is still there in the system. It's not that cancer is cured. She's a little more comfortable in quality of life, in quality of movement, and there is some glow in the face. Then she said, Doc, I just want to take a 2 days break and visit my friend. And she's actually in Ipoh. So I said, but Anne, you have to be very careful. You don't eat any non-vegetarian. You have to make sure you take the medicines properly. You have to make sure that you don't stop anything. Yes, doc, it's only 2 days. I'll come back in 2 days. And I just want to visit her because she's coming to pick me and I don't need to worry about it. I'll carry my medicines. And, I'm slightly better. And I'm also trying to see whether I can do something to help in my friend, to whether I can do something to help some money. So I said, okay, you can go and come back, and you better make sure that the medicines are. So then she asked, okay, I will carry the medicine. I'll follow the instructions. And the friend came, and the friend took her, and she did not come back for 3 months.
Oh, she
3
disappeared.
months, she just disappeared. And we also wonder what happened, and there's no contact number to contact us. After 3 months, then I got a call from the GH hospital, from General Hospital. She called me and said, Doc, I'm in ICU. Can you come and see me? So I went there. She was almost back to the square.
Oh, no.
And then I asked, what happened? No, actually, no. Everybody was asking me, why are you taking only vegetarian, only rice, porridge, and vegetables? And You need some protein, you need some egg, you need some fish, you need some non-vegetarian to build up, and you will heal very fast. Now your immune system is so poor. So I just indulged in that. So I said, yeah, but do you know it's very difficult again to bring you back? Yeah, but I don't want to be here. Can you take me back to the center? So I said, yeah, but it is not going to be the same, but it's okay. I don't want to be here. I know that I won't survive here even another week. So she expected that I will talk to the doctor. And then I talked to the friends, but I said, okay, let me see. And doctor said, yeah, anyway, we can't do much. If she wants to be there, it's fine. You can take her back. She came back, but she didn't survive. I think in 7 days, she passed away. So it was we could do something, but because of a simple, when you are giving wrong information without knowing it, I don't know whether she would have survived for another 5 years or 2 years, but at least, this was something where we didn't introduce much of a medicines. We didn't introduce much of treatment or something. It was just simple care.
Diet. And they just go for all these alternative medicines. How can you incorporate alternative medicines or Ayurveda into the lives of these people who are terminally ill?
See, I'll tell you, there's yesterday I had this doctor, a patient, actually, he came to me, and he had a colon cancer in 2017. He did a surgery and he did a 6 cycles of chemo. And 2019, again, he got a second attack in the descending colon. Again, he did the surgery, but second part, he didn't do the chemo. So third part, this is recently in May, June, he was diagnosed with the sigmoid colon, which is in the lower part of the rectum. A change is happening. The tissue confirmed that it's an adenocarcinoma of the same thing which happened to.
It's another cancer. Yeah.
So he said, Doc, I'm not interested to go for the chemo again, and they are asking me to do the chemotherapy and everything. I said, okay, that's what they are suggesting. What do you feel? I don't know. So I said, at this point of time, whether you're trying alternative medicine, whether you're taking conventional system, whether you're trying any treatment program, nobody's going to give you a thorough answer that this can be healed.
And no guarantees.
There's no guarantees also. So why do you have already tried that? Don't you think it's better we incorporate both? You go ahead with the surgery or you go ahead with whatever they are doing. I can incorporate something and then that will be more beneficial. And this Ayurvedic herbal combination will help you to reduce the side effects of the chemo, improve the quality of life. You can stay here, go do the chemo and come back. We will help you in planning the diet, because I'm sure in 2017, when you have the surgery and after chemo, if you would have come to me, you won't get the 2019 second attack, because I could have helped you in selecting the food and selecting the diet style and the lifestyle to protect you from getting a second attack. But unfortunately, that information was not passed to him. And I'm sure that plays a major role. So he basically had everything under the sky. He had that, this and everything, second attack. In second attack also, the advice was not given what not to eat, what to eat. So he just thought everything is healed. Now I said, this is already third. Planning a diet will make a huge difference, but it won't be the same like 2017. So in some cases, I tell them, what do you feel? Do you have the confidence? No, I don't want a patient to be with me going through the Ayurvedic treatment, but 90% fear in the brain or in the heart. Oh, will this work?
Yeah.
Is this going to be
doubt?
okay?
Yeah.
So at the same time, I say, if you have the 100% thinking that the chemo, you don't like it, don't do it. But the decision has to be taken by you. not by me, not by anybody. It has to be taken by you. You should have the complete confidence in your healing. Then you try anything, it will work. It should not be like, because I suggest, okay, do this that way. But if you ask me, my personal opinion is you do both. For you, integration will be the best. Because at this point of time, if I introduce something, I don't know how far it is going to help you.
Yeah.
I don't know how far it's going to be. Then he said, no, doctor, I don't want to try conventional. I just want to. I said, okay, if you want to try that, I'm ready to do that. I will definitely support you. I will tell you what treatment should be done. I will tell you what medicine to be done. I will tell you how to be treated. I explain everything. So, in some cases, it is better incorporate. In some cases, it's better they do their part. We do our part. It is always better. We just give the freedom for the patient to understand. And, we always believe that, when you make the patient understand what is his sickness and what is the stage and how it happened and how can be protected, what is going to happen. This understanding itself is 50% healing. So that is the responsibility of a physician, I believe, is to make the patient understand what is his sickness, how it developed. Then the healing.
Oops.
Yeah.
Then you started. Then the healing what?
So that means, like Khalil Gibran said, understanding itself is the beginning of healing. So if the physicians are able to make the patient understand, this is your sickness, this is it happened, this is what you should do, this is what you're not supposed to do, and then the healing starts. If the patient doesn't have understanding about his sickness, the healing is quite challenging.
Okay.
He has to understand it.
So we need to know our body, the severity of how bad our illness is, and then only act upon it.
Then only he will take that much of effort. Sometimes, see, there was this patient who had a diabetes which was 26. The level was 26. So I told the patient, your level is 26. The normal is below 5.2 fasting. It's very high. The normal, very high. So the patient is asking me, so don't you think with the diet and exercise? Yes, diet and exercise will help you. But what was your breakfast? Oh, I had naslama.
Oh God. Oh my God.
What we had yesterday? Yesterday I had I think roti chana and a coffee. But doc, I don't put full sugar. I put only half. You think he's already.
One last question, doctor. I'm curious to know. Have you ever healed a skeptic before?
Oh yeah.
Yes, we have. I have.
Like people who don't believe in Ayurveda, and then you still manage to heal them because you said it takes belief.
Yes.
To be able to be healed.
Sure, because see, when you get a suffering, when you get a sickness, it is 80%. Once it's established, it's in the body. Okay, for an example, a diabetic wound, which is completely established in an ulcer, where the doctors are telling your toes has to be amputated because there's no circulation to that area. And he came with his daughter, and he was very reluctant. He said, I don't want my leg. Let them cut it off. I don't want to think about anything. So the doctor said, he's already 56 to 60 years old, and he's the only breadwinner. He tries, and we have a feeling if he is not able to do it. So can you just try? I am taking treatment here. My mother is taking treatment, but he don't want to take it because he want to smoke. He want to drink, and he knows that if he stay here, he will not be able to do that. That's okay. Then I convinced him. I said, you give me 2 weeks. If it improves, you continue. So very reluctantly, he stayed here. And we will have to do the dressing morning and evening and bandaging it and give him the medicine and the food, and he don't want to take that. Because vegetarian food, he still asks his daughter, get me something in fish fry, one small piece can you bring? I won't tell anybody. And he managed to bring that fish in without our knowledge. But the next bed people informed us he had fish in the lunchtime. So we asked him, why are you doing? No, doc, this is horrible. Your rice porridge and vegetables, very difficult to take. But his toes got improved. He could actually heal. So that means when you see, that is the thing, like, we know these are the 5 elements in the body. When this is deranged, you get a sickness. And when we are introducing this herbal combination to the system will respond to it. Because you're not giving any wrong food. You're not giving any. But at the same time, like you said, if there is a fear, if there's no belief in, sometimes, it definitely interfere. Instead of taking 6 months, if you have the belief, it can happen in 1 month. That also happens there.
So Ayurveda treatments, you have to be vegetarian?
Not necessarily. Not necessarily. We don't. Ayurveda is not against non-vegetarian. In some conditions, like if you have a cancer or if you have conditions of asthmatic condition, or if you have a conditions of skin, for an example, psoriasis is a very common skin condition. Yeah. Generally, the theory is that it's an autoimmune disease; it cannot be healed. That's the theory. But we believe if a person who is a psoriasis patient, if he can follow a vegetarian diet along with some herbal formulations, it can be healed. So there, but at the same time, after the oil treatment, everything is over, he preferred to start his non-vegetarian and fish. It will come back.
Okay.
So that is the challenge, that he has to take a decision. It's not
It's compromise. It's a compromise.
But in many other conditions, non-vegetarian is okay.
Okay.
Are you vegetarian?
I'm a vegetarian.
All right. Just wondering.
All right. I think that's all the time we have.
Yes.
With you, Doctor.
Sorry it took so long. Yeah,
Thank you so much.
Very fascinating chat.
Yeah, for that insight
Thank you.
into the Ayurvedic world. Actually, I might bring my husband there. He keeps having eczema, but inside his nose, and it's really painful.
Yeah.
It cracks and all that, and we cannot figure out what is it that's causing it.
See, Dr. Siby.
Vegetarian first, and then bring him.
Yeah. Yeah.
He has to be vegetarian, Bel.